Chronic Obstructive Pulmonary Disease, or COPD, is a serious lung condition that affects millions of people worldwide. Knowing the causes can be key to prevention. So, stay tuned as we explore the top causes of COPD and what you can do to lower your risk. Let's get started. 1. Smoking. The most common cause of COPD is smoking. Cigarette smoke contains thousands of harmful chemicals that irritate and inflame the lungs. Over time, this constant irritation damages lung tissue, leading to the narrowing of airways and destruction of alveoli, the tiny air sacs responsible for gas exchange. It's estimated that around 80 to 90% of COPD cases are caused by smoking. 2. Air pollution and occupational exposure. Long-term exposure to harmful pollutants and irritants can also cause COPD. This includes outdoor air pollution, whether in car traffic or industry, and occupational exposure in jobs like factories and mines. 3. Genetic factors. While smoking and environmental exposures are major risk factors, not all smokers develop COPD, and some non-smokers do. This indicates that genetics play a role. A well-known genetic cause of COPD is a deficiency of a protein called alpha-1 antitrypsin. This protein helps protect the lungs from damage caused by inflammation. A deficiency in this protein can lead to early-onset COPD. 4. Chronic respiratory infections. Repeated or severe respiratory infections during childhood can increase the risk of developing COPD later in life. Infections such as pneumonia and bronchitis can cause inflammation and scarring in the lungs, which may weaken lung function over time. 5. Asthma. People with asthma, particularly those with uncontrolled or severe asthma, may be at an increased risk of developing COPD. Asthma is a condition characterized by chronic inflammation of the airways, which can cause airflow limitations similar to COPD. Individuals with asthma who smoke or are exposed to environmental irritants may have a greater likelihood of developing COPD. 6. Aging and gender. As we age, our lung function naturally declines. For some people, this decline is more rapid, leading to COPD. The risk of developing the disease increases with age, particularly after the age of 40. Additionally, women appear to be at greater risk of developing COPD than men. 7. Socioeconomic status. People with lower socioeconomic status may be more likely to develop COPD due to a combination of factors such as increased exposure to air pollutants, occupational hazards, higher smoking rates, and limited access to healthcare. COPD is largely preventable by avoiding smoking and reducing exposure to lung irritants. Early detection and lifestyle changes can slow the progression of COPD and help manage its symptoms effectively. If you or someone you know experiences chronic coughing, shortness of breath, or frequent respiratory infections, it's important to seek medical attention to assess for COPD or other lung conditions. If you found this video helpful, make sure to give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to Pete's Health and Fitness for more health tips and wellness information. Stay healthy, stay informed, and see you next time.